Hi, I'm John Cullen. Welcome to another episode of Hypothetically Speaking. I'm excited about this show. I've got a lot of really good information to share with you guys. I think you're going to enjoy it. We've got some pretty big aspects of the story in this episode of Hypothetically Speaking. What we're going to take a look at in this episode, the retreat of COVID. And the question that we're going to try and answer in this episode, are the English more observant than the Americans? And before we get into the material, I thought I would just share a couple observations with everybody. So first, let me run this video clip for you. Let's take a look at that and just insert or replace the word war with the word pandemic. Okay, let's watch this together.
Someday this war's gonna end.
And someday this pandemic is going to end. I guarantee it. I have a bunch of material I want to share with everybody, and that material comes from the CDC. So all of the information that you're about to see is being sourced from the Centers for Disease Control. And all I've done is build some visualizations of this data. So this is the source, is the CDC, and that's for coronavirus. And all the data that you're going to see on influenza is also coming from the CDC. This is their FluView interactive website. And on this website, they show you all the different aspects of what's happening with influenza. Two separate websites. One website is for coronavirus, and then the other website is for influenza. Now, the coronavirus deaths that the CDC reports, the number's a little bit lower than what you're going to see on the Johns Hopkins map. Okay, because these are real death certificate type filings from coroners and medical examiners. This is all based on CDC data. All right, so everything we're about to see is from the CDC and the WHO and the maps that they're providing, right, and all the data that we have here. So these are the sources that we're using. First of all, tip of the hat to one of our viewers who pointed me in the direction of an article in The Sun in the UK. And this is a pretty big break, and so I want to share this with the audience. So tip of the hat to David. Thank you kindly. This is how we do it here at the John E. Hoover channel. This is a crowdsourced operation, and you guys represent, truth and justice, and keep bringing stuff like this to the table, and then we dig in, and this is how we do it. So the story is that flu and pneumonia, PNI, is now killing 6 times as many people as coronavirus, as deaths are at their lowest since the lockdown in the UK. Now, this story was reported 4 days ago on August 18th. I'm recording this on August the 22nd, New York time. Has anyone heard this? Have you seen this reported on CBS or NBC, CNBC, CNN? Have you heard flu and pneumonia, PNI, is now killing 6 times as many people, 600% more than coronavirus in the UK? and coronavirus deaths are at their lowest since the lockdown. Now, we've been reporting that coronavirus was going away in the United States as early as the 4th of July, but then it started to pick back up again. But if you look at the chart on daily deaths that they have up here right next to the chart that's next to Boris is showing the daily deaths, and it really started to wane in mid-June, looks like June 20th, going into June 30th. So a couple weeks before the United States, their daily death rate really started to decrease. And what's interesting is now P&I, influenza, is killing 6 times more people. And you're not hearing this in the United States. So how is it that they figured this out in the UK? Who figured it out? Right? So they're reporting that deaths of coronavirus are dwindling and influenza is climbing. Now they're reporting 7,600 influenza deaths in the same period. So the time frame we're looking at here is an 8-week time frame. And what they're saying is in the 8-week time frame, so over the course of the last 2 months, 7,600 people have died from the flu, and 3,144 have died from coronavirus. And it looks like the flu deaths are going up, and coronaviruses have somewhat plateaued or leveled out. So this is over an 8-week period that they're reporting this, right? So they're saying for 8 weeks in a row, this is the first line in the story, influenza has killed more people in the UK than coronavirus for 8 weeks in a row. That's 2 months. That means for the past 2 months, and we're 3 weeks into August. So 3 weeks into July, 3 weeks into June. So since 3 weeks into June, for the last 2 months, influenza is killing more people in the UK than coronavirus. But you're not hearing that in the news in the United States. Are you hearing that in the news in Australia? Are you hearing that in the news in New Zealand? Are you hearing that in the news in Canada? Is anybody reporting that influenza, has killed more people in the UK for 8 weeks in a row? 6 times as many people. I mean, this is significant, right? This is data, not my data. I'm somewhat fascinated by the fact that the New York Times is getting scooped by the Sun. I think that's great. More people have been dying from flu than coronavirus for 8 consecutive weeks, according to the Office of National Statistics in the UK. Now, again, these are not my numbers. This is the Office of National Statistics in the UK. And what they're showing is that more people are dying from influenza than coronavirus. That's not a theory. That's not a conspiracy. That's the Office of National Statistics in the UK. That's official. Why won't the U.S. news media report this? And weeks and weeks and weeks ago, we did a show, Jason and I, where we looked at the abattoirs and we asked, is there some spreading capability here? Is something up with Smithfield Foods and companies that are butchering meat? Sure enough, story breaks today. Coronavirus survives on frozen meat. All you have to do is handle it. It's not about cooking it. It's about touching it, and it gets on the countertop. And then you touch your face, and you're infected. So this abattoir angle that we were investigating weeks and weeks ago, it appears that was pay dirt. that in fact something was up there. Our spidey sense was correct. Coronavirus is in blue. Influenza is in bright green. Influenza season begins the first week of October. We call that week number 40. And when we get to week 52, that's New Year's. Week 1 is New Year's Day, January 1st. And so you see that influenza was killing people for a long time. Then along came coronavirus. But what I'm going to point out in these charts is a really important observation that you need to take note of. So when we went into this coronavirus story, we're trying to figure out what's happening here. And sometimes what you think is the story isn't the story. I thought that this season's H1N1 influenza outbreak, claiming more lives than coronavirus, according to the CDC, I thought that was the story. I thought that we broke a huge aspect of the story, which is that more people were dying from influenza than coronavirus. But that's not the story. It turns out that by investigating this story, we uncovered a deeper story, a bigger story, a story that's, again, like the Vegas research, hard to believe because it's so over the top. But I'm going to present it to you because it's based on facts, it's based on evidence, and it's based on data that comes from the CDC and the National Institute of Health. When we look at influenza and coronavirus side by side, the phenomenon that we see here is evidence that neither number includes the other. There are weeks where coronavirus deaths outpace influenza deaths. And then there are weeks where influenza deaths once again outpace coronavirus deaths. And so neither one of them can include the other. And the reason is you have weeks like week 20, 21, 22, 23, where the numbers are very similar, but in the course of 1 week to the next, one virus has more deaths than the other. If either of them were inclusive of the other, that category would always be bigger. In other words, if influenza deaths, the green category, always included coronavirus deaths, the green line would always have to be bigger than the blue because it would be influenza and coronavirus. So because they're discrete and completely separate, they appear discrete on the chart. And in no way can it work that way. I mean, it's like a logical paradox. It just doesn't fit. So the coronavirus deaths and the influenza deaths, completely separate reporting, discrete numbers, they're not included in one another. And this chart is how we know. This is the chart that allows us to see that because each one of them is the higher number in a given week. In other words, when we look at weeks 21, 22, 23, influenza deaths are higher than coronavirus. But in weeks 14, 15, coronavirus is higher than influenza. Well, that's impossible if influenza included the coronavirus numbers. Where we stand right now as of August 22nd in the United States is 229,000 people have been reported to have died from P&I, that's influenza and related pneumonia, and 160,000 have been reported to have died from coronavirus. So again, continuing talking about a 60-40 split. Disturbing part is when we add these two numbers together, we're getting very, very close to 400,000 people dead in the United States. So sometimes what you think is the story isn't the story, right? And it turns out that this whole, influenza's killing more people than coronavirus during this pandemic, I thought that was it. I thought that was huge. I thought that was the big deal. But that's not it. That's not the story. The story's bigger than this. Way bigger than this. 10 times bigger than this. And that's when it gets really scary. The real, true story is so over the top, it's hard to believe. And the bad guys are counting on that. If the big story isn't the greater number of deaths from H1N1 than coronavirus in the USA this season, then what is the story? It's this. It's that over the course of the last 11 years since the swine flu outbreak in 2009, at minimum, it appears that the CDC has been reporting death numbers from influenza, their influenza statistics that they're reporting to Wikipedia, to the public. It's not consistent with the data that I'm pulling from the mortality database. The discrepancy is huge, and the discrepancy has been going on for as long as I can get the data, and I can go back to 2013. So I've got 7 years of data. I can't go all the way back to 2009 yet, but I've got from 2013 to 2020 for influenza deaths, P&I deaths. And what I'm comparing is the statistics from medical examiners and coroners, and I'm comparing that to the public information that the CDC is putting out, saying, well, this is how many people died last year of influenza. Once again, I'm not sure anybody's been checking the math. Has anybody audited these people? Is there inspector general for the CDC? If not, maybe we should check their expense reports too, because these guys are really bad at math. Whatever it is they're reporting here, what you see on the Wikipedia page about influenza statistics and how many people have died per year, that's not what their systems say. And that's where I'm getting the data, is from their database. This is the problem. This is the story. This is huge. According to the CDC, we've had fewer than 75,000 people die each year from influenza. Numbers like 32 and 41 and 50 and 60 and 36 and numbers like that. And I plug the numbers into the spreadsheet, so the representations here are real. The bright green lines represent the data coming from the National Center for Health Statistics, from their mortality surveillance system. And so it seems that we've been averaging 175, 180,000 people a year have been dying from P&I. That seems to be the real number according to the National Center for Health Statistics. That's where I'm getting the data from. I'm simply downloading it and popping it into the chart. The other bar chart, the CDC Dr. Fauci says number, that's coming from here. I'm pulling that from what they're saying publicly from their, each year they do a report that says this is how many people died from influenza. So I'm pulling those numbers and comparing those numbers that they report to the National Center for Health Statistics P&I numbers. This year, we're 229,000 people. We haven't broken through the 200,000 barrier before, but the numbers have been in the 175, 180, 190,000 range. And the CDC is just like 3 licks to get to the middle of the Tootsie Pop. Nobody bothered to check their math. This goes back to 2013. Have they been doing this since 2009, since before that? And then why? Why are they telling people one number when the other number is the number that appears to be the accurate number? Why are they not telling people about Tamiflu and Zofluza? Why aren't we hearing that you should be taking these these treatments. Yeah, I get it about the vaccine and everything, but if people are sick and people are dying, shouldn't we be telling them that they should be taking oseltamivir and Xofluza? I don't know. But I find this stunning. And what we're seeing here is a discrepancy of over 100,000 people a year between what the CDC is saying publicly, 30,000, 40,000, 50,000, and the real number, 175,000, 180,000, 190,000. I mean, these are their numbers. I'm just putting them in the chart. This year, 229,000. All of a sudden, it doesn't seem like such an anomaly. It is the biggest one, but it's in the neighborhood. And I was surprised by that. I thought this was going to be huge by comparison to the previous years. And when I saw this, I said, oh my God, this is the story. They've been running this racket, it appears, hypothetically speaking, for years. Are they not telling people that 180,000 are dying each year from P&I because they want people to keep taking the vaccine that's only 30 to 40% effective, according to them? Again, I don't know. I don't know what the motivation is. But if there's a treatment for influenza and 180,000 people a year dying from it, again, that seems like at minimum malpractice and maybe at worst negligent, homicide. I don't know. This is the story. This is earth-shattering. And this is from the CDC. One day, this virus is going to go away. And when that happens, justice needs to be served. I'm John Cullen. Thanks for joining.